Most people think of inflammation as something obvious. A swollen ankle, a sore throat, a red, painful joint. But what if the most harmful inflammation is the kind you don't feel at all? The kind that quietly builds in the background, shaping your health for years before you ever notice a symptom. Inflammation isn't just a short-term reaction to injury or illness. It's deeply connected to how your body ages, how your immune system functions, and how chronic disease develops over time. Today, we're going to look at what inflammation really is, why it matters more than most people realize, and how everyday choices quietly influence it, often without us knowing. Inflammation, at its core, is not the enemy. It's a survival mechanism. When you cut your finger or catch a virus, your immune system triggers inflammation to protect and heal you. Blood flow increases. Immune cells rush in. Repair begins. This is called acute inflammation, and it's essential for life. The problem begins when inflammation doesn't turn off. Instead of being a short-term response, it becomes chronic, low-grade, persistent, and often invisible. You may feel mostly fine. You may function normally. But beneath the surface, your immune system stays slightly activated, day after day. And that constant state of alert slowly changes how your body works. So what does this mean in real life? Chronic inflammation places ongoing stress on your tissues and organs. Over time, this stress contributes to damage at the cellular level. Research has linked long-term inflammation to conditions like heart disease, type 2 diabetes, autoimmune disorders, arthritis, and even certain cancers. But the effects aren't limited to physical disease. Inflammation also affects the brain. Studies suggest it plays a role in persistent fatigue, brain fog, mood changes, and even depression. This is why some people feel tired despite sleeping enough. Why mental clarity comes and goes without a clear reason. Why recovery feels slower than it used to. Inflammation doesn't always announce itself loudly, but it influences how resilient your body feels every single day. One of the most surprising things about inflammation is where it often starts. Not from injury, not from infection, but from daily habits. Highly processed foods, excess sugar, poor sleep, chronic stress, physical inactivity, and constant exposure to environmental stressors all signal the immune system to stay alert. Individually, these factors may seem small. Together, they create a steady inflammatory environment. Stress, in particular, plays a powerful role. When stress becomes chronic, cortisol and inflammatory signaling stay elevated. Your body never fully returns to baseline. Over time, this creates a feedback loop. Stress increases inflammation, and inflammation makes the body more sensitive to stress. This is why lifestyle and biology are never separate conversations. They're deeply connected. Here's where inflammation becomes truly important. Chronic inflammation doesn't usually cause immediate illness. Instead, it accelerates decline. It speeds up arterial aging. It interferes with insulin signaling. It weakens immune balance. In other words, it makes the body less adaptable. And long-term health is not just about avoiding disease. It's about maintaining adaptability. The ability to recover, to respond, to stay balanced as conditions change. When inflammation stays high for years, the body's margin for error shrinks. Small issues become bigger. Recovery takes longer. Resilience fades. This is why inflammation is often described as a common thread connecting many chronic conditions. Not because it causes everything, but because it quietly influences how everything progresses. So what can you do with this information? Not drastic changes. Not extreme routines. But small, consistent choices that help the body return to balance. First, prioritize regular, quality sleep. Sleep is when inflammatory signaling naturally resets. Second, focus on whole, minimally processed foods most of the time. Not perfection, just patterns. Third, move your body daily in ways that feel sustainable. Movement helps regulate immune and metabolic function. Fourth, manage stress intentionally. Even in simple ways. Quiet moments, breathing, boundaries, and rest all matter more than we think. Finally, pay attention to how your body feels over time, not just day to day. Long-term signals are more meaningful than short-term fluctuations. Inflammation isn't something to fear. It's something to understand. Your body is constantly responding to the environment you place it in, your habits, your routines, your pace of life. Long-term health is rarely about dramatic interventions. It's about reducing the silent pressures that build up over years. When you support your body's ability to recover, adapt, and regulate itself, you're not just preventing disease. You're investing in resilience. And that's one of the most valuable forms of health there is.